majority of the remaining provincial mask requirements will be lifted tomorrow, some settings like the TTC are still encouraging people to wear their masks. The mixed messaging is making it difficult to predict what the future will look like.
I think it feels good that we're finally back to being normal. Most places have it removed, so it feels really good.
For me, it was some sort of safeguard in place, and so I'm kind of disappointed that it's being lifted before the vaccines are in place for the younger set.
As of tomorrow, you do not have to wear a mask when riding transit. However, healthcare settings, including many hospitals like Toronto's University Health Network and Sick Kids, say they will continue to keep masking policies in place.
I'm not opposed to if they still had restrictions in the hospital setting. I think that kind of makes sense right now, especially if the healthcare professionals are asking for that.
The City of Toronto has decided individuals need to remain masked in shelters, although it isn't required by the province as of tomorrow. Simply recommended.
When we look at this decision around healthcare settings, when we look at the evidence, when we look at the actual safety that masks can bring, especially for those that are most at risk, it does seem premature.
The Chief Medical Officer of Health, Dr. Kieran Moore, stresses that mask wearing will continue to be optional and dependent on personal preference. Mayor John Tory and the TTC are still recommending transit users wear a mask. Dr. Susie Hota sees a problem with the mixed messaging.
I personally would have liked to see mask mandates continue a little longer, just because when it's mandatory, it's very clear to people what the expectation is. There's no variability, there's no decision making, there's no, oh, it's okay, it's not absolutely necessary.
Masks will still be required in long-term care and retirement homes. With the summer months upon us, the risk isn't as high for now.
The situation with COVID-19 is improved in most parts of the country, and people are outside a lot more. So hopefully the risk of that translating into, a bump up in cases is not going to be very substantial at this point.
While Dr. Hota says the next few weeks aren't too concerning, both she and Dr. Andrew Buzari have their eyes on the fall.
It's a lot of work to get these mandates in place. And when you actually start to lift and pull them back, trying to reintroduce them in the fall or having people make their own decisions when it's not entirely clear, we continue to see some mixed messaging in the public, only results in confusion. And that confusion puts those who are most at risk at harm.
Both Dr. Hota and Dr. Buzari suggest people to wear their masks in crowded spaces like indoor settings such as the TTC and healthcare settings.